Hello, my name is Daniel Lozano and I am an EMT basic student at San Jacinto College North. Today I have been dispatched to a motor vehicle incident involving a rollover and the patient that has been ejected from the vehicle. As I pull up to the scene, I will automatically place BSI, body substance isolation, using gloves and goggles. I will also check for any possible hazards to myself or the patient. Once I determine that the scene is safe, my partner and I approach the patient. I will assess the patient for a level of consciousness. I will do this by speaking to the patient, seeing if they can hear me, and seeing if they respond to pain. Hello, sir. Can you hear me? Can you hear me? I have determined that the patient is unresponsive. Now that I've determined the patient is unresponsive, I will determine and assess for circulation, airway, and breathing. I will do so by checking for any possible bleeding, hemorrhage, seeing if they have a pulse. First off, noting any major injuries, I notice that there is an open fracture of the left femoral bone involving major hemorrhage. Noticing this, I will attempt to control the bleeding using an occlusive dressing or a gauze. I will apply firm pressure and attempt to stop the bleeding. After determining that the bleeding is not stopped, I will not remove the dressing and I will use a tourniquet. Now that I have determined that the bleeding has stopped, I will assess for further circulation problems. I note that there is no other major bleeding. I assess for equal pulses on both arms. I detect a weak and 30 pulse. After that, I will assess the head and I will assess for any possible airway obstructions. I will do this while my partner maintains manual inline immobilization using his hands. I will perform a jaw thrust maneuver to avoid any possible injury to the spinal cord. I will use a jaw thrust maneuver, open the mouth. I determine there are no obstructions, no secretions. I will now listen for breathing. The patient is breathing. There's equal bilateral chest movement. I will now auscultate to see if there are clear breath sounds. The patient has clear breath sounds. After determining there are no other ABC problems I need to immediately address, I will move on to my secondary assessment. I will also determine that this is a critical patient and I will transport as soon as possible. Before doing so, I will check for any possible deformities, DCAP, BTLS. That includes bruises, contusions, abrasions, all of that. Any step-offs in any spinal areas. I will begin with the head. We'll assess for battle sign and determine there is no fluid exiting the ears. I will now assess the neck, searching for any step-off. There is no JVD, no tracheal deviation. I'll now work my way down to the chest. I notice the patient senses some pain in his right side, his right chest, and there is some deformity. I will now move down to the abdomen. I'll palpate, make sure it is soft, not rigid. The abdomen is soft, not rigid. I'll assess the pelvis. There's no motion. There are no fractures of the pelvis. I will assess the extremities now, moving through the legs first. There are no deformities on the right leg or the right foot. The femoral area of the left leg has a fracture, an open fracture. The lower leg does not have any deformities. I'll assess the arms. No deformities. The skin is pale, cool, and humid. He's sweaty. I will administer high flow oxygen via a non-breather for now, as he is not having any difficulty breathing. I will also throw on a blanket to make sure he does not lose any body heat from entering possible hemorrhagic shock. Since he is a good candidate for spinal immobilization, I will place an adequately sized C-collar on my patient while my partner maintains manual inline stabilization. After I have placed it, I will assess for circulation in the extremities, for sensation, although I will not receive a response from my patient as he is unconscious. Once that is complete, on the count of my partner who is maintaining inline stabilization, I will rotate my patient onto his side, check the back for any deformities, any step-offs, any serious injuries, move a backboard under and roll him onto it. Secure him to the backboard, reassess for anything, and then I will load him into the ambulance and transport him promptly to the hospital for definitive care. That is all.